Besides COVID-19 cases, Alberta has the highest rate of syphilis in Canada. Now, researchers at the U of A are trying a strategy. It's a 2-for-1 test that also looks at HIV. As Su-Ling Goh reports, the results take just 5 minutes, so the patient can get treatment sooner.
2 new rapid tests for HIV and syphilis involve a finger prick and a plastic device, similar to a home pregnancy test.
It has a controlled dot that will show up on the surface, and then 2 other dots if the test is positive for syphilis or HIV.
Infectious diseases specialist Amita Singh is leading a U of A study to test both tests for potential Health Canada approval, screening 1,500 at-risk people in Edmonton and Northern Alberta.
So I'm really excited to give this a try here in Edmonton, where we have incredibly high rates of syphilis right now.
Edmonton has the highest syphilis rates in the country, with more than half of Alberta's 1,600 cases in the first 9 months of this year. In that same period, 23 babies were born with syphilis in Alberta. Another 7 were stillbirths. In 2019, Edmonton also made up nearly half of the province's 250 cases of HIV.
If you have an infection with syphilis, you're much more likely to get HIV if you're exposed to it at the same time as well.
The rapid tests produce results in 5 minutes. Then patients are treated for syphilis on the spot. Standard lab tests can take 2 weeks for results.
Currently, in some settings, we lose about 20% of people to follow-up, so they don't return for a test result, or there's a significant delay before they're located and offered treatment.
Syphilis often affects hard-to-reach populations, people with unstable housing, mental health issues, or addictions. Dr. Singh says sexually transmitted infections and high rates of meth use in Edmonton go hand in hand.
And we know that stimulant drugs change and influence people's sexual behavior.
Untreated syphilis can lead to vision and hearing loss, heart attack, and dementia. It can cause developmental delays in babies if they survive. Su-Ling Goh, Global News, Edmonton.